So very good evening, all of you. Welcome to our first dinner session of 2021. We never had dinner sessions this year. I think this is the first ever dinner session 2021. Last year we had several breakfast and dinner sessions. So this will be our first dinner session this year, where we'll start with a case-based discussion, as I mentioned previously. So today we started our day, a beautiful day with 5 a.m. club. We meditated. We also learned something about 2-DG, an interesting molecule, glucose molecule, 2-deoxy-D-glucose, which is being used clinically as anti-COVID drug. Also, we posted a question in updates group, and most of you have answered it right. I really appreciate your enthusiasm. So also, another speciality of these dinner sessions is a couple of years ago, we used to start with music. So again, now, even last year, we never played any music. So this year, we'll again start our session with some beautiful music, right? So those which are provided by YouTube and will not have any copyright issues. I hope you enjoyed the music initially. So let me know if everything is streaming fine. I think this is something which I should ask at the beginning of this session, but anyways, I'm glad I asked, at least now, because it's better late than never. Okay, so let me know how the streaming is. So we'll go ahead with our presentation. We have lots of information to share, and also today, for the first time ever, we will be using a virtual whiteboard to provide you some important points, and also we'll use a PowerPoint presentation, right? And we'll share some images as well to make things even more interesting. I hope you guys are all ready. Okay, right. I hope, yeah, thank you, Sorni, for the feedback. Yes, so we'll go ahead. Yeah, I'll get back to all your messages as soon as possible, okay? So we'll start with our presentation now. So, as you know, we're launching a summer batch this May 2021. So this is something which we done this morning in 5 a.m. club. So we'll try repeating that form of meditation every day for the next 6 days, right? So this is what I was mentioning previously. Those who missed morning session, do check out information about 2-DG molecule, 2-deoxy-D-glucose, which is approved as anti-COVID drug. We discussed this at length in the morning session. You can go through that video in your free time. Also, this is a press release by Ministry of Defense, right? So this is a case-based equation which we'll be highlighting or focusing on today in today's session. So as you can see, a patient came with forearm fracture for which cast immobilization was done, as you can see in this representative illustration. After 6 weeks, on opening of cast, forearm muscles looks wasted. What may be the reason for wasting? Starvation atrophy, ischemic atrophy, neuropathic atrophy, none of the above. So let's keep these options aside. Let's focus on the case scenario, context. So as you can see, I've tried to highlight a few key points in this entire case history or in this context-based question. Immobilization and wasting of muscles. So these are the clues which you have in order to answer this question. As I mentioned previously, case-based questions are in fact easier to answer than regular format MCQ questions if you know how to answer them and if you have the necessary concept with you. So in fact, you'll be provided several hints in the process which will definitely help you in answering any case-based or clinical-based question, which we have been discussing in our test series, including in our study club discussions if you observe. So a patient came with forearm fracture for which cast immobilization was done. After 6 weeks on opening of cast, forearm muscles looked wasted. So talking about immobilization, talking about wasting of muscles, what could be the reason? Before we jump into the answer, I know we're all interested in finding out the answer, but that completes everything, right? And also we become narrow-minded in the process. So let's try to dig out this particular topic, atrophy, and also look into various pathological types of atrophies along with some illustrations, for which I said be ready with your notes, right? So that we can provide you inputs, and simultaneously I'll be entering all of these points on whiteboard, virtual whiteboard. So first of all, what is atrophy? So from here, we'll just shift the slide and we'll move on to another virtual background. As I said, virtual whiteboard, which we'll be using for the first time. Yes, I hope you all can see this virtual whiteboard and let me know. Your feedback is always welcome. Okay, so I have my keyboard and mouse alongside, right? So we'll go ahead. So first of all, what is atrophy? You can just post in the comments, right? By the way, none of you have provided the right answer, okay? But don't worry. As I said, we'll not jump into the answer straight away. We'll first focus on the concepts and then we'll move on to the key, right? So first of all, what is atrophy? So what do you think atrophy is? So as you know, as clearly mentioned in Robin's pathology, as a name itself, as the word itself indicates, A means absent, trophy means growth, lack of growth, loss of growth. So by definition, according to Robin's pathology, it is shrinkage in size of the cell because of loss of cellular contents, isn't it? So you can simultaneously make a note of these points as I'll be typing out here for your convenience, okay? Shrinkage in size of cell by loss of cell substance. So this is the definition of, or the meaning of atrophy. I know we all hate definitions for the obvious reasons. Okay, so this is the meaning of atrophy. I hope a black is better. Yeah, let me just leave it, right? So this is the meaning of atrophy. So there are several causes of atrophy, especially when we are talking about pathological causes. So pathological atrophy, there are several causes which we'll try to highlight now. Okay, so we'll start from extreme left so that we'll have more space in the process. First and foremost, in fact, you'll come across some of them in the form of options. We'll also try to provide you more causes or types of this atrophy. So starvation atrophy, and if there are any spelling mistakes, excuse me, or you can let me know in the comment section. So we'll give space to each one of them so that we can enter additional points a bit later. So different types of pathologic atrophy, starvation atrophy, and some of you seem to have answered it as ischemic with this particular question. We'll get back to that. So we have ischemic atrophy, so ischemia leading to atrophy. Let's see. Also, we have disuse atrophy, and then we have neuropathic atrophy, endocrine atrophy, endocrine related causes, which we'll see in a short while from now, pressure atrophy, pressure related changes leading to atrophy, and we have the last category, idiopathic atrophy. So this is broad causes, different causes of pathologic atrophy. So starvation atrophy, ischemic atrophy. I think we can use a spotlight here, yes. So starvation atrophy, ischemic atrophy, disuse, neuropathic, endocrine, pressure, idiopathic. It's very simple. We'll look into various, we'll in fact try to look into the meaning of each of these kinds of atrophies, and also we'll look into some examples, including illustrations, which will be presented to you a bit later. Okay. So first we'll start with starvation atrophy. So let me just put some arrows. It is, oh, how do I undo it? Yes, yes, I got it. Excuse me, I'm using it for the first time. Just give me one moment, okay? Take an eraser. Yes, I could finally know how to use an eraser. Actually, I wanted to use a red color arrows. So let me just put all the arrows first. I mean, simultaneously you can make notes. You know, you have that choice, right? Instead of finding my difficulty in using this strange, you can simultaneously make notes. So first, starvation atrophy, will post illustrations here, the examples here. But what is starvation atrophy? As the name itself indicates, starvation, loss of carbohydrate loss, of fat loss, leading to ultimately protein catabolism, can lead to starvation atrophy. In case of chronic hunger, we usually see those illustrations. We'll get back to that a bit later. So severely ill patients, you can just make a note of it. Severely ill patients, or even in cancer patients, if you observe, we call that condition as cachexia, right? Okay, so you can just make a note of these illustrations. Now, what about ischemic atrophy? So ischemia leading to atrophy, we have some best examples. So shrinkage of kidney in case of renal hypertension, in case of renal stenosis. So ischemic atrophy is gradual diminution of blood supply. It can be because of several reasons, including atherosclerosis, which can result in shrinkage of the affected organ. The best example which I can give you is atrophic kidneys. So my typing skills are being tested here. Atrophic kidneys in atherosclerosis of kidney patients, right? This is one illustration which you can make a note of. Yeah, and also atrophy of brain in case of cerebral atherosclerosis, okay? And we have so many examples. We'll jump to the illustrations a bit later, okay? And then diffuse atrophy. So what could be the best example for diffuse atrophy? I mean, you must be telling me. So atrophy of pancreas or even parotid gland in case of obstruction of ducts. So we have another example which will not be giving out for the obvious reasons. So disuse atrophy. So because of lack of functional mobility leads to atrophy. So prolonged diminished functional activity is associated with disuse atrophy. Example, atrophy of pancreas in obstruction of pancreatic duct. Right? So this is something which you can make a note of. And then neuropathic atrophy, neuropathic causes. So interruption in nerve supply. The best example which I can give you is poliomyelitis, right? And endocrine atrophy. So because of loss of endocrine regulatory mechanisms, either in case of hypothyroidism, hypopituitarism, there can be atrophy of the affected organs. So the best example which I can give you is hypopituitarism leading to atrophy of thyroid, adrenal glands, including gonads. So that's the example which I'm going to put here, right? So if at all there is an example and you're asked like which kind of atrophy does it fall under, you must be able to answer, okay? So endocrine atrophy, the best example I can give you is hypopituitarism leading to atrophy of, you can mention thyroid gland, okay? Just as an example. And then pressure atrophy, we can mention so many tumors and their pressure related effects, including cysts for that matter. So we'll just mention one or two examples. So pressure atrophy, prolonged pressure from benign tumors or cysts or aneurysms may cause compression and eventually leading to atrophy, right? So let me give you one example. We have so many examples here. erosion of spine or erosion of skull. This is the illustration which we'll be presenting. So let me just enter this. Erosion of skull by meningioma, right? And then we have idiopathic atrophy. So the word idiopathic means unknown. So we don't know the exact cause. So one of the examples that was given under idiopathic atrophy is testicular atrophy. Okay. Right. So I would definitely recommend you to remember all these examples, right? And also we have several other examples. You can do some homework, dig them out, and then add up those examples to your notes as well. So atrophy basically is nothing but shrinkage in size of cell by loss of cell substance, which you're all very much familiar with, right? And we have different types of atrophy as we have seen. And also these are various illustrations or various examples, illustrations of which we'll be seeing very shortly. So starvation atrophy, ischemic atrophy, disuse atrophy, neuropathic atrophy, endocrine, pressure, and idiopathic atrophy. Now, let's save this and then let's quickly move on to our presentation again so that we can look into those illustrations for better remembrance and understanding, right? Yeah, so this is a case-based patient which we have seen. The patient comes with forearm fracture for which cast immobilization was done. After 6 weeks on opening of cast, forearm muscles look wasted. What may be the reason for wasting? So you guys have answered. So before you answer, look at this illustration. So starting clockwise from 10 o'clock position, you can see starvation atrophy, clear cut. You can appreciate the fact that several muscles are wasted in the process because of starvation. So in starvation, there is first a depletion of carbohydrate and fat stores, followed by protein catabolism. So there is general weakness, emaciation. Emaciation means a state of being abnormally thin or weak, as you can see in this illustration. And also there is anemia, which is referred to as cachexia in cancer patients and even in severely ill patients. Illustration B, you can see a comparison of size of kidney. So obviously the left one is normal and the right one is shrunken, right? So it is ischemic atrophy, right? Ischemia related effects. So gradual diminution of blood supply due to atherosclerosis may result in shrinkage of affected organ. As you can see, small atrophic kidney in atherosclerosis of renal artery, atrophy of brain in cerebral atherosclerosis, which I have mentioned and quoted previously. And then illustration C, you can see active inactive muscles. So this is disuse atrophy, right? Obviously, the person on left illustration seems to be having hypertrophied muscles compared to the right-sided illustration. So disuse atrophy, prolonged diminished functional activity is associated with disuse atrophy of organ. So atrophy of pancreas in obstruction of pancreatic duct, parotid gland, etc. Right? So I'm sure you can answer the case-based question. And also you can look into illustration D. So poliomyelitis, post-polio effects, you can see neuropathic atrophy, interruption of nerve supply leading to wastage of muscles. Other examples apart from poliomyelitis include sectioning of nerves, also motor neuron diseases, right? And then illustration E, you can see shrunken thyroid gland, so endocrine atrophy. So as I mentioned previously, hypopituitarism. So loss of endocrine regulatory mechanisms resulting in reduced metabolic activity of tissues, and hence, as a consequence, you find atrophy. So this is thyroid gland which is shrunken. So hypopituitarism leading to atrophy of thyroid, adrenal, including gonads. Also hypothyroidism, which may cause atrophy of skin and its adnexal structures, associated structures. And finally, pressure atrophy. So 7 o'clock position, illustration F, you can see it's a CT image of a case of meningioma on right frontal bone, specifically on the right side, where you can see because of this meningioma, there is a loss or erosion of frontal bone, which is clearly evident in the 3D CT on the right illustration, right? So erosion of spine by tumors in nerve roots is one example. Erosion of skull by meningiomas, as you can see in this illustration. Erosion of sternum because of aneurysms of arch of aorta, right? So various examples for pressure atrophy. So these are some of the illustrations which I wanted to highlight along with various causes of pathologic atrophies. So now you answer the question. So what do you think is a more appropriate answer is? So most of you have answered it as previously B, A, so whatever it is. So what do you think is more appropriate answer? You can see the keywords immobilization, wasting of muscles, so which indicates that there is atrophy. So immobilization is nothing but you're not using it because of the cast, which is placed because of fracture. So it's all linked up, right? So which one do you think is more appropriate answer? So also in this process, for the first time, we used our virtual whiteboard. Do provide me feedback, and we'll try to improvise accordingly. In fact, I think this is quicker way of doing things on whiteboard compared to the real board, which is right here alongside. Because typing, it's comparatively faster than writing out examples or sentences. But whatever it is, do let me know the feedback. So I'm sure you can answer this question now. And before I conclude, I have one homework question, just one question. I'm not going to burden you with series of questions, just one question, okay? So what's that homework question? Gold-black kidney. I'll spell it for you. Goldblatt. Goldblatt. Gold-black kidney. So what is gold-black kidney? Do find out, and you can either get back through mail or I think that's a better option, right? There will be more active participation. So find out what gold-black kidney is. Get back through mail within 24 hours, at least by tomorrow 8 p.m. IST, and we'll try to get back to you as soon as possible. Also, today morning we had this 5 a.m. session where we discussed about 2-DG molecule. So some of you have mailed for articles, additional information. We'll get back to you as soon as possible. So I hope the session was useful for you, and we'll conclude the session. But before we conclude, we're going to conclude this with beautiful music. So we'll start and end with some wonderful music. And before that, let me just go through your comments. And I really appreciate all your active participation. Hi, Rishikesh, Valarmati. Hi, Valarmati. A very good evening. Hi, Rituja. I'm really surprised to hear from you. I thought you're busy in your own world. I'm really glad that you joined us live. So how is everything going on? I hope your husband is also doing fine. I'm missing you all, guys. Hi, Rennie. We'll not go subject-wise. We'll be going like in a cumulative format. The main focus will be case-based questions. It can be from any subject. The irony here is, even though when we say subject-wise, each and everything is interlinked. I mean, if you look into this particular case-based or context-based question, we're discussing topics from general path, right? We're discussing topics from which are relevant even in the surgical aspect. We're talking about casts and we're talking about fractures, right? So there are, in fact, so many subjects interlinked in any case-based question for that matter. So we'll go in a cumulative manner, trying to discuss and trying to get, confident in the process of answering various case-based questions with different parameters incorporated in it. So we'll do it in a cumulative fashion. Okay. Hi Harshit. Hi Priyanka. I'm fantastic. How are you? Hi Harita. Very good evening. Ritu, Monica, Bhavya, Priya. Hi. Oh, very good evening. Hi Manav. Hi Akanksha. Sohini, Sonali, Bhagyashri, Pallavi. Priyanka says the clean shirt face doesn't suit you. Is it Priyanka? First of all, I never had a beard. Only 3 years or 4 years ago, I started having this beard. But it's summer, right? By the way, if it doesn't suit me, I don't mind at all. You know what? I know I'm beautiful with beard and even without beard. I'm sorry, I think I must use the word handsome. I'm handsome with or without beard. Okay, I'm just kidding. By the way, that's true, right? Vrunda, very good evening, Vrunda. Hi, Fernandez. A very good evening. So, evening sessions, we have more participation, and in fact, we're seeing the other part of the world. Whereas in morning sessions, we miss most of you. Hi, Aisha. Hi, Anantam. Hi, Saif Ali. A very good evening. Hi, Dr. Nidhi. Okay, so initially you guys answered option B, but I'm sure now you might have changed your answer. Hi, Devi. A very good evening. Good, Monica. Yes, fantastic. So it is option D, none of the above. Hi, Vaishak. So you know the answer and you know the reason. Do I need to again tell you that this is the answer and this is the explanation? We have gone through the entire content and that's the objective of this session. It's not just about finding out the right answer. It's about trying to understand the content or the concept behind the same. So we have seen some colorful representations. We have seen different types of pathologic atrophies along with some illustrations. I'm sure you can answer any question for that matter from this particular context-based question. In fact, after this session, we're going to post just one question along with gallbladder kidney. Just try to find out. It's a homework question. Apart from that, we're going to post one MCQ in our Telegram updates group. So to test you to what extent you have followed the session. Okay. Right. So it was lovely interacting with you. And I really encourage all of you to participate even in the morning sessions. So 5 a.m. Indian Standard Time, sharp 5 a.m. Just wake up at least once and see the difference. But if you sleep at 2 and wake up at 5, it's going to be horrible. But try sleeping early, wake up early, and try not to have dinner after 8. Okay? I know we need to resist lot many temptations, but do it at least once. Experience the difference, and you're never going to leave it. Leave that particular format of, or leave that particular lifestyle. Okay, guys. So just try finding out what gallbladder kidney is, and I hope you enjoyed this session. And your feedback is always welcome. Wish you all the best. Love you all.